MIT Mayo Physical Science Center for Drug Distribution and Efficacy in Brain Tumors. And myself and Jan Sarkaria are the co-PIs. And basically, the overarching hypothesis of the center is that if you have poor or heterogeneous drug distribution in brain tumors due to the blood-brain barrier and other physical limitations in delivering drugs to the tumor, or potentially having drugs leave the tumor, as Bill Elmquist will talk about today, that you would end up with basically poor drug efficacy and patient response. And if we could actually define and model some of these parameters that actually influence drug distribution and drug delivery to the brain tumors, we'd be able to come up with better therapeutic strategies for brain tumors. And so the aims of the center are really, aim one is really the research aim, and it's really to develop this multi-scale model of the key physical parameters that influence delivery of these targeted therapeutic agents. And aim two and aim three are really about collaboration and outreach and education and outreach, with the goal of basically getting more people involved in collaborations with the center, for one thing, collaborations with the Physical Sciences and Oncology Network for another, but also getting more people involved in physical sciences and oncology together. So the team of people, many of which are here, involve several people from MIT, myself, Doug Lofberger, Dane Wittrup, Natalie Agar from Harvard, as well as Jan Sarkaria, Jan Tran from the Mayo Clinic, Kristen Swanson, who's unfortunately not here due to flight issues coming from Arizona yesterday, and Bill Elmquist from the University of Minnesota. And as I said, one of the main goals of our center is actually to encourage collaborations. So if there's something you hear in one of the talks this morning that you're particularly excited about, and you want to talk to one of the people in the center about potentially collaborating with them, then this is really a great venue to try and reach out to people here at MIT and in the surrounding Boston area. I don't know if anybody is here from outside of MIT, but anyway, other than Nat's group. All right, so here's the main idea of the science, is that basically we're going to combine non-invasive imaging through magnetic resonance imaging and MALDI MSI for drug distribution, as you'll hear about from Nat today, to try and understand basically, can we map the physical parameters by using non-invasive imaging that really define drug distribution. And then from that drug distribution, can we get an idea of drug efficacy and tumor cell response to different drug concentrations, and then basically put all of that together in this multi-scale model that will go from a non-invasive image all the way through to drug selection for each given patient. And in order to sort of give some idea of the science behind this center that we've established, we've invited, well, that got messed up. Anyway, Jan Sarkaria from the Mayo Clinic, the co-PI on the grant, Natalie Agar from Harvard, again, who's going to talk about mapping of drug distribution, and then Bill Elmquist, which the role of efflux transporters in, like I said, that got really messed up for some reason, even though I just pasted in a PDF. Anyway, all right, so without any further ado, Jan is the first talk of the day.